Hi, my name is Dr. Paulina and I'm a sports physiotherapist practicing in London. Today I would like to talk to you about hip pain in active women. If you are an athlete or if you are participating in any sport, women are pretty susceptible to hip pain. So hip pain can come up in women because of many reasons. There could be tendon issues, which we call tendinopathy. There could be some inflammation in the tissues such as bursa, or there may be some problems within the joint itself. The common symptoms are typically the pain in the side of the hip, and sometimes this pain can even radiate down the leg. Often it stops women from participate in any physical activity. This can have some strong consequences. If you're an athlete, then you can't train. But even if you're just an active woman and you like your weekend runs, this, of course, is limiting your activities. It's very important to diagnose this hip pain to make sure that we choose the best treatment for you. The diagnosis usually starts with a conversation, so with subjective examination, in which I will usually start thinking about what is your current activity, what is your current loading, what do you do, how much load and how much biomechanical forces this hip is exposed to in your everyday life. I will also be asking about the mechanism of this pain, whether there was any injury, maybe there was any acute event that started this hip pain, or whether this pain just came up and is now bothering you, maybe intermittently. We will be also looking at the pattern of injury and pain. It is important to have a look at how you move. There are some clinical tests that we do as physiotherapists to make sure that we fully understand what tissues are included in this hip pain, to then make sure that we create a perfect treatment plan for you. If we are still not sure, if we are still seeing some challenging outcomes of this examination, we want to have a look at some investigations such as MRI or X-ray scans. It is also very important for us to understand how your body moves functionally. The body, especially lower limbs, are subject to many major forces, and therefore how muscles work together is very important for us to understand, to see where this injury or pain comes from and implement the best treatment. It is also important that women in hips and pelvis differ from men. Currently, the guidelines that we have are typically based on male data. Therefore, it's very difficult for us to give this equal access to healthcare for women. Understanding the differences between men and women in the hip and pelvis area is also important to fully comprehend the biomechanics of the hip and groin pain and to implement that in the treatment. So what is the treatment for hip pain in active women? First of all, we will have a look at the loading management. It will mean that probably we'll have to limit some of your activities that are currently painful and that currently your body doesn't want to do and doesn't want to endure these loads. That might not have to happen for a long time, but it's important to offload the hip and make sure that the tissues have enough space to heal. It might mean that we might limit activities such as squatting or lunging or running because of certain forces that might be affecting your hip, such as deep hip bending or some repetitive impact. What is also important is to implement the exercises that will help us optimize the biomechanics and address some potential weaknesses that are in your body. Very often hip pain comes from a suboptimal load management around the hip. So some muscles are a little bit stronger than the others, and therefore the other muscles are just not supporting the hip so well. Implementing specific hip exercises that are helping your body to create this good, healthy and strong movement is the most important thing to make sure that you can be healthier for longer.